All right, here we go. Hello, everyone, and thank you for watching this program on DCPTMD integration. There's no audio taping or videotaping allowed, in any unauthorized reproduction, copying, or forwarding of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not supposed to be a substitute for your thorough clinical decision making. Target coding does not engage in providing legal services, and there is going to be some legal stuff we're going to be talking about later, but we do not provide legal services. We're not a law firm. You'd have to attain the services of a healthcare attorney. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotlar. I am a chiropractor. I'm a certified professional compliance officer. I'm a certified billing and coding specialist. My areas of expertise include CPT, ICD-10, and HCPCS coding, Medicare compliance, HIPAA compliance, record keeping, treatment plans, and how to create compliant cash plans. I've written many documentation and compliance training manuals. I write articles for numerous publications throughout the country, like Chiropractic Economics, Dynamic Chiropractic, the American Academy of Professional Coders. Write articles for many state association newsletters. Plus, I'm a guest speaker at many state association conferences nationwide. So, DC-PT-MD integration. Let's first go through some of the pros and cons. Let's start with the pros. It's a great way to co-treat patients. You know, when I transitioned my practice from chiro only to multi-specialty, it was just nice having other healthcare professionals there to share in the health of the patient. When I was alone, so to speak, in practice, and I had a question about a patient, I either had to, had a friend come over, I'd have to drive over to a friend's office or a medical doctor's practice and go over everything. It was just nice having other healthcare professionals right there to assist me with any questions that I have. It definitely adds another dimension to your practice. It adds a whole nother department, so to speak, to your practice if you bring on another healthcare professional that provides services that you never provided. And one of the reasons why I became multi-specialty is because I just wanted to be able to treat more patients. For example, as a chiropractor, I wasn't able to treat directly patients for cardiovascular disease. And even if I was not able to perform intravenous vitamin and mineral therapy or other services, injections, couldn't do that as a chiropractor. So having a medical doctor come in, it allowed me to offer more services that I couldn't physically do. So I was able to see more people, adds additional services, and it adds additional marketing opportunities. Also, if you're in a state where the chiropractor has to perform the therapies, for example, in the state of New York, CAs are not allowed to do any therapies. So if you bring on a physical therapist and other healthcare professionals, they can do the therapies and the modalities. You don't have to do them anymore. Definitely more marketing opportunities. You'll bring in more new patients. So those are many of the pros. Now, there are some cons. Overall, I think integrated practices are very nice. I think it's a great way to practice. However, there are some negatives. And if you're talking to people that are very pro-integration, they don't necessarily share with you the negatives. They paint a very rosy picture that it's great for everybody. Well, it's not great for everybody. You're going to have more overhead you might not be able to afford. I was speaking to one doctor recently where he wanted to bring on a medical doctor, but he didn't realize how much they demand as far as salary. He was ready to go. He wanted to bring on a medical doctor to see patients in his practice, and he was bringing on an MD, and I told him that it's probably going to cost about $180,000 a year to bring on the MD that he was looking to bring on. I said, do you have $180,000 to pay the medical doctor? And he said, no, I can't afford, $3,000 to $4,000 a week in salary. So that was the end of the conversation. He was not able to do it. There were other options I gave him, percentage and rental, but it just didn't work out. So it's not for everybody. You're going to have more overhead. You might need more rooms. I have a few clients, they would love to bring on other healthcare professionals, but they only have 500 square feet. So you may need more rooms. You're going to need to cover malpractice costs probably of the other healthcare professionals. Unless you can get lucky and they bring malpractice coverage with them, there's going to be many other costs associated with these providers. It's going to add more work and probably confusion to your existing staff. Being in practice for many years as chiro only, and then I brought on other healthcare professionals, my CAs that were just used to me, now they have other healthcare providers asking them to do things. It was uncomfortable for a couple of my staff members, and they quit. They just didn't like having other bosses, so it could cause confusion. Just got to be ready for that. Sometimes it's hard to find. I have a couple of clients in Ohio looking for a physical therapist to bring on. They just can't find them. They're hard to find, and turnover could be very stressful. I had a medical doctor that I spent a lot of time, invested a lot of time and money getting him on panels and credentialing and getting him board certified, sending him to classes, getting him in network with a lot of plans, paying for the malpractice. And then after 6 months, he said, I quit. I'm moving back to Argentina. So then I had to start the process all over again. That could be stressful. So there's definitely pros and there's definitely cons. Next, corporations, your corporate structure. How are you going to set it up? That's one of the first things you should be thinking about. This could be a make or break situation for some of you, whereby if you have to form a new corporation or transfer your entire practice into a new corporation that could be partially owned by the medical doctor or the physical therapist, that could be stressful for some of you. You might not want to do it. But there are three options: employer, employee, partnership, and with a management company possibly, and you could just rent space to another healthcare provider. So let's go through employer-employee. So in that situation, you're going to hire and employ other healthcare professionals like medical doctors and physical therapists. So all the billing goes out under the employer tax ID, and the employer pays the medical doctor and the physical therapist salary. Employer receives all gross revenues from the practice and pays, less the MD and PT salaries, taxes, and overhead attributable to the services. And there should be, this is where you must get a lawyer and have a comprehensive employment agreement put together that outlines the duties, the responsibilities, who's paying for malpractice, non-compete, confidentiality, who's going to pay for CE credits, how about sick pay, vacation pay, health insurance, all of that stuff should be built into the employment contract. Next, you have a partnership. So you may want to join forces. For example, in some states, chiropractors cannot employ MDs or PTs, but you can go into a partnership and form a partnership. Sometimes it's called a PLLC, Professional Limited Liability Corporation in certain states. You have to check with your accountant and attorney on that, and you could become partners. So in that case, all the billing goes out under the group tax ID. All the partners share in the compensation that's attributable to the entire practice based on ownership in the business. And then you need to get an attorney to put together a operating partnership agreement, which should include details such as the capital contributions to the practice, just the day-to-day management, significant decisions, delineate the duties. That was one of the problems in my MD, DC, PT practice. One partner in in particular, he was not living up to his responsibilities. So it's because we didn't delineate what he is supposed to be doing. He thought he was doing a great job. The other partners, including me, did not. So that got a little uncomfortable. So you want to delineate the duties, who's going to pay for disability insurance and, terminating the relationship. How is that going to go? What's the out clause? So partnership. And then you might have to have a management company, which typically the chiropractor owns, which provides services to the medical corporation, such as marketing and payroll, housekeeping. Changes to the medical corporation should be fair market value. There should be an agreement with the management company. It should be at least 1 year in duration, and that sets the fees in advance. Next, if you'd like, you could rent space to a physical therapist, an acupuncturist, a medical doctor. That's fine. So the MD or the PT is going to do their own billing under their own tax ID. You're going to get rent from this healthcare provider. It should be fair market value. You need to put together a sublease agreement. If you don't own the building, you should probably check with your landlord to see if you could sublease space to other healthcare providers. So you should have some sort of a sublease agreement which specifies what can they do as somebody renting your office. Can they use your computers? Can they use your phone, your fax machine? Or you want them to bring in their own equipment? You want to delineate that. This agreement should be for 1 year in duration. And the most important thing is when you're renting, the rent should not be based on referrals or how much you collect from insurance companies or how much they collect from insurance companies or, a percentage of the practice. Be careful with that. Next, how do you find people to work for you? How do you hire them? Let's go over a little bit of those things. So there's 2 sets of people you're going to be hiring. They're called QHPs, which stands for Qualified Healthcare Professionals. Qualified Healthcare Professionals. That's a QHP. A QHP is an individual who's licensed to be able to perform the service and is performing a service within his or her own scope of practice and could independently report that service or bill an insurance company. That's a qualified healthcare professional. Different than a clinical staff member. A clinical staff member is a person who works under the supervision of the chiro, the PT, or the MD, or other qualified healthcare professional who is allowed by law to perform the service but cannot individually report that service. So here's examples of QHPs. Qualified healthcare professionals include medical doctors, chiros, osteopaths, physical therapists, nurse practitioners, physician assistants, licensed massage therapists, acupuncturists, nutritionists. Sometimes nutritionists can bill out for their own services. Sometimes they can't. That's why I have them in both categories. Clinical staff, we're talking about your chiropractic CAs, PTAs, athletic trainers, medical assistants. See, a chiropractic assistant can perform services in many states, like ultrasound and set a patient up on traction. However, cannot bill an insurance company just with the CA's name on the claim. That's why they're considered clinical staff versus qualified healthcare professionals. One of the most common QHPs hired in an integrated practice are nurse practitioners. Nurse practitioners can initiate care plans. They have gone above their regular traditional nurse degree. They've gone to a master's or a doctoral degree program. There are about 325 programs, nurse practitioner programs in the country. There are about 155,000 nurse practitioners in the United States, 190,000 physical therapists, 65,000 PTAs. Nurse practitioner average salary is about $80,000. Licensed in all states. They can focus on health promotion, disease prevention, counseling, guiding patients, and making smarter health decisions. Next, the state rules can be complex. Sometimes they're hard to find, and they may conflict with the federal rules. Also, supervision, that could vary greatly from state to state, and it can vary from insurance company to insurance company. For example, some insurance companies, you don't have to have, they say you don't have to have the PT on site when a PTA is doing the service. Well, Medicare says, whoa, time out. Medicare says if you're going to bill us for a physical therapy service and performed by a PTA, the PT has to be in the office. So you have to check with your state board and the types of qualified healthcare professionals and clinical staff members you could employ and what services they're allowed to perform. As I mentioned, there are some states where CAs are not even allowed to put a hot pack on a patient. And other states, CAs can do just about everything except adjust. So you need to inquire who also needs to be on premises when the procedures are performed. These are all things you should be doing to be proactive. That's what I'm all about. Prevention, preventing coding and billing errors, avoiding audits, preventing having to give money back to insurance companies. We're talking about compliance. Compliance means being proactive and trying to prevent billing and coding errors. It's actually mandatory if you are seeing Medicare patients. It's mandatory that you put together a formal compliance plan to show how you make formal efforts to prevent billing and coding errors. We're going to go over that a little bit later. Now, where do you find MDs and PTs? Ask your patients. You could start just by asking your patients. That's what I did when I started looking for a PT. I just started asking my patients. Whenever I needed something, I always asked my patients. If I was looking for a car, if I had a patient who was a car dealer, I asked my patient for assistance. If I was looking for an electrician to do some work around my house, I always asked patients first. But if you can't get any luck that way, contact schools, contact the local medical physical therapy offices. I started calling when I first started looking for a medical doctor to work with. I just started calling local offices. I called the local hospital. I just said, hey, my name is Dr. Kotlar. I'm looking to expand my practice, make it a multi-specialty practice. This is what we're looking to do. This is what the patients we're trying to treat. Are you interested? I got more people interested than I expected. Now, if you need to spend money because you're having a tough time finding a staff person to help you out, then you might have to put money into an ad or job placement site like Indeed.com. I've had some of my clients get staff members just through Craigslist, believe it or not. There's placement agencies. But, if you're going to, put an ad in the paper, something like we have a great position to work in a state-of-the-art facility. We emphasize high-quality care. We offer competitive benefits. Full-time, part-time, experience desired, not required. Is speaking another language important? You may want to indicate that a background in sports injuries or post-surgical care is needed. You may want to state that experience with manual therapy and deep soft tissue work is needed. You may want to put in the ad the actual amount of money you're looking to pay, either yearly or hourly. Have them email you references, fax you their resume. Now, once you get them in for an interview, you're going to share with them that this is a serious position, and you got to let them know that they're going to be responsible for evaluating, planning, directing, administering treatments, coordinating, and delegating and supervising responsibilities. They need to participate in office training. They have to understand and comply with your office compliance program. If they're going to be providing services, they need to know the clinical rationale. For example, for orthotic devices, how to instruct patients on home care instructions after an injection or something like that. Next, you probably want to make a decision. Do you want these integrated, these other doctors and staff members, PTs and acupuncturists, DOs, Do you want them in the plan or out of the plan? Do you want them in network or out of network? So now you have to deal with some credentialing issues. They need an MPI number. You're going to see Blue Cross Blue Shield patients probably need a Blue Cross Blue Shield credentialing first and then contracting. You're going to see Medicare patients. They have to have PTAN numbers, and you may need to, if you want these MDs and PTs to be in network, you're going to need to fill out the managed care applications. That could be time consuming, filling out those applications. Oh, if you see Medicare patients and they're going to see Medicare patients, you want to have that 855R form, the reassignment of benefits, sent over. Just make sure you know all the in-network and out-of-network rules and regulations on medical necessity, billing, and admin. And then credentialing, again, you got to make those decisions. Are we better off in-network or out-of-network? If the chiro's out of network and then you want the PT in network, will the plan allow the same tax ID to have a hybrid, some in network, some out of network? Just things to think about. Take a look at the fee schedule. In network, the fee schedule is different than out of network. Does it seem right? You're going to get more new patients being in network or out of network? Can you charge cash, even though in network, for non-covered services? Hopefully you can. All right, now let's go through some of the common services in an integrated practice. We'll start off with the physical therapy services. So there's different types of supervision. I mentioned this earlier. So personal supervision means you're in the room. So let's go with PT and a PTA example. Personal supervision means the PT is in the room with the PTA when the service is done. Not typically necessary. Direct supervision means the PT is in the office, but not in the room with the PTA. General supervision means the PT is not there. PTA is in the office. PT is not in the office, somewhere else in another office. That's general supervision. Now, Medicare requires the PT to be on site when the PT performs the service. That's an example of direct supervision. Now, there's also certain incident to rules you should be aware of. You may be able to bill for services incident to without the provider being on site. For example, MD, nurse practitioner, could bill incident to. The incident to services can be billed when the MD and the nurse practitioner are both in the office, but the MD doesn't have to perform the service. If you have questions on incident to, let us know. Having the chiro and the PT see the same patient on the same day for the same diagnosis is something I do not recommend. PT evals, they have 3 eval codes. They used to only have 1. So 97, 161, 162, and 163. They're intended to be used to report an evaluation at the beginning of an episode of care. Reevaluations, there's 1 code for reevaluations, 97164. Again, these are physical therapy codes. Chiropractors should not be using these codes. Reevaluations in the PT world, when the patient is not responding or progressing as expected, the patient has a flare-up, an exacerbation, or the patient has reached maximum improvement. You want to document what's going on, updated plan of care, any adjustment in the goals. Physical therapist, physical therapist can do all the services you see on your screen, hot and cold packs, mechanical traction, unattended electrical stim. Those top 3 are the most common. Or these are modalities. You don't have to stay in the room with the patient. They're not time-based. Constant attendance modalities. There's attended e-stim. Ultrasound 97035. That's the most common. Constant attendance modalities. These are time-based. These require one-on-one contact. Now, there are certain services that you may be doing. Make sure you're doing these properly. Vibration therapy, if the patient is not performing anything while standing on the vibe plate, that's not billable, or you might be able to bill 97039. Most insurance companies won't pay for it. If the patient is doing an exercise, that's a different story. Hydrotherapy beds, just be careful what codes if you're billing for these. Also with handheld instruments, some insurance companies won't pay for handheld devices. Next, physical therapists can perform therapeutic procedures. This is the manner of effecting change through the application of clinical skills that attempt to improve function. You are required to have one-on-one contact. These are time-based codes. If you're going to bill therapeutic exercises, make sure you know that that's an active procedure. The patient has to be performing an active procedure. Here's a few examples. Balls, bands, tubes, weights. The patient is performing the service. These are foot levelers, rehab equipment here. Very simple. You want a patient to do some neck exercises. They have something called the Nexus. It's just an isometric, fantastic exercise the patient could do. You just hook it on a wall or a door. Now these two services you see on your screen, this is not therapeutic exercises. These are passive stretching type of services. This is not considered therapeutic exercise. Passive care is not exercise. So that's it for the physical therapy services. Now we have acupuncture. Acupuncture. Here are the first two codes here, 97810. That's acupuncture without stim for the initial 15 minutes, and 97811 is an additional 15 minutes with reinsertion of the needles. 97813 is acupuncture with electrical stim for the initial 15 minutes. And then 97814 is an additional 15 minutes with electrical stim with reinsertion of the needles. So acupuncture is based on a 15-minute increments, face-to-face, not the duration of the needle placement. If you put the needles in and you walk away for 15 minutes and then come back, take the needles out, that does not count towards a billing code. Only one code could be reported for each 15-minute increment. The 97811 and 97814 indicate 15 minutes with reinsertion of needles. A 15-minute increment is defined as one-on-one contact. That means the acupuncturist is in the room performing medically necessary activities like chart review, discussing with the patient the review of the last results, inserting the needles, manipulating the needles, removing the needles, reinserting the needles, disposing of the needles, counseling and coordinating care with the patient. There's a lot that goes on with acupuncture, but it can be very, very lucrative. Next, trigger point injections. Excellent. Medical doctor has to do this, or a DO or nurse practitioner. Chiropractors and physical therapists are not allowed to do trigger point injections. Here's a little description of what trigger point injections do and the codes. If you're going to do trigger point injections on, let's say, Aetna patients, make sure you get the Aetna trigger point injection policy. Medical doctor should read it. Everybody that's involved, even staff, anybody that's involved with performing the trigger points, that's billing for the trigger points, that's sending reports to insurance companies, should be reading these policies. Here's a Medicare fee schedule for trigger points. 20553 have $72.52. Next, joint injections. Joint injections, there's many different codes for joint injections. There's 20600, that's an injection without ultrasound guidance into a small joint like fingers and toes. 20604 is with ultrasound guidance. 2065, now we're talking about medium-sized joints like the wrist, elbow, ankle without ultrasound. 20606 is with ultrasound guidance and the medium-sized joint. Then we get into large joints like the hip, shoulder, the knee. That's 20610 without ultrasound. With ultrasound is 20611. Next, NCVs and EMGs. Make sure your medical doctor, if the medical doctor is doing it, understands the codes, the clinical rationale. Here's another insurance company policy on NCV. Good idea to read it. What the indications are, what diagnosis codes should be used. Here's needle EMG. There are many, many codes for needle EMG. We're not talking about surface EMG. You should not be using these codes for surface EMG or dynamic EMG. These are needle EMG, CPT codes, many of them. Here's Cigna's policy on EMG. If you see Cigna patients, get a hold of this. Members of Target Coding, you know, if you need any of these, you contact us. We get them for you. You don't have to go searching. Nutritional Consultations, terrific. Many chiropractors do nutritional consultations with patients. Here are some of the codes. 97802, medical nutrition therapy, initial assessment, face-to-face 15 minutes, reassessment 97803, and then group nutrition therapy. Now, these codes have very low RVUs. Don't get too excited if you do nutritional consultations. And according to the AMA, if a doctor provides medical nutrition therapy, you should be using regular E&M codes. And now we have a whole bunch of other, these are cash-based services. Insurance doesn't pay for these things, like stem cell, platelet-rich plasma injections, that's PRP, Prolotherapy. Maybe some insurance companies pay for Prolotherapy. Hormone injections, doubt it. BioFeedback, most don't pay Chiros for BioFeedback. Hyperbaric oxygen therapy, not covered. Weight loss, not covered. You know, you could add laser to this list and decompression. These are some of the most common services provided in MD, DC, PT practices that are cash-based. Insurance does not pay for most of these things, which is terrific. Right? Most of the doctors I speak to, they like providing cash-based services. Now, if your medical doctor or PT is seeing Medicare patients, you're required to have a Medicare billing and coding manual or compliance manual. The OIG requires it. The OIG, Office of Inspector General, is responsible to protect federally funded programs like Medicare and Medicaid from criminals, from people that are trying to rip off the system. So chiropractic and physical therapy and medical services are covered in the Medicare program, so they do reports, they do analysis. Here's one OIG report that was on this physical therapy office. I think they were in New Jersey, and the OIG found that they billed incorrectly, and they had to refund $29 million, according to the OIG report. Here's one on chiropractic that stated we billed for maintenance care as active treatment, and they overpaid us like $300 million. So Medicare wants providers to be proactive. What does that mean? Having formal staff training meetings. What does that mean? Documenting them, putting them in a training log. Many reasons to have a billing and coding policy manual. Even if you don't see Medicare patients, you should have a billing and coding policy manual. Your staff wants organization and leadership. They want to work in an ethical, trustworthy atmosphere. If you have a staff member that's accusing the owner of the practice of wrongdoing, a policy manual could contain the ammunition to defend against any alleged misconduct. Policy manual can prevent audits. It's a custom-made document. You can tell your own story. For example, some of you do full spine adjustments. Patient comes in just with neck pain, but you'll check the thoracic, the pelvis, the lumbars, and you'll adjust those areas. So you're doing a full spine adjustment, but you're only billing $98940. That's not okay. Is it? Maybe it is. You should have a policy on that. OIG, compliance, billing and coding manuals are based on these 7 essentials. Now, we have a Medicare compliance manual that we create for chiropractors and physical therapists and acupuncturists. Well, Medicare for acupuncture, no. My billing and coding policy manuals for acupuncturists is a non-Medicare billing and coding policy manual. It's a little different. But for the medical doctors and physical therapists and the chiropractors we work for, we've created a compliance manual. There's 18 policies and procedures. You see them on your screen. One of the things you're supposed to do is a chart review, an internal review, or an internal audit. You need to take out a couple of patient charts, a few patient charts 2 to 3 times a year, and score yourself. It's an open book test. You score yourself. If you see Medicare patients, you have to put your name into the exclusions Medicare list to see if it pops up. Hopefully it doesn't. But if you or a staff member, right, staff members you need to put into this list, their name pops up, cannot allow them to see Medicare patients. If you have a staff member that's been excluded from the Medicare program and they're seeing patients, or staff members are involved with Medicare patients and Medicare finds out, you're going to have to give back all the money. Not fun. So be proactive. As I mentioned earlier, you want to prevent problems. Read the coverage policies from the health plans you bill. Review them with your staff. Enter those staff meetings into your formal training logs. Attend seminars, webinars, read books. Watch videos. A policy and procedure manual can prevent audits, help you sleep better. Now, there's a difference between Medicare compliance and HIPAA compliance. The main purpose of Medicare is to prevent billing and coding errors. The main purpose of HIPAA is to protect patient health information. So, a little bit about HIPAA. HIPAA became a law, many years ago, August 21st, 1996, over 20 years ago. Again, the main purpose is to protect patient health information. Now, HIPAA applies only to covered entities. Are you a covered entity? Maybe, maybe not. I'm going to ask you 2 questions. Do you bill or receive payment from insurance companies? If you say yes, you are a covered entity. Next question. Do you submit claims electronically? If you say yes, you're a covered entity. So most of the medical doctors, PTs, chiropractors, acupuncturists that I work with are covered entities. So that means you are mandated to have a HIPAA compliance program. Now, just having a few forms that the patient signs and you have your computer screens hidden and you talk quietly in the office, that doesn't mean you're HIPAA compliant. HIPAA compliant means you have formal policies and procedures. For example, do you have a policy on backup? If you had a flood, a fire, a storm, something came in and wiped out your computer, do you have a backup? Probably yes. Maybe everything's in the cloud. Great. You have to have a policy on that. It has to be in writing. We have Carbonite backup. We have antivirus software, Norton, McAfee, right? All of those things need to be in a book, have to be in writing. It could be in the cloud. Our HIPAA compliance program, you get both. Some of our clients, they want to go all green. So everything's in the cloud. Everything's digital. We have other clients, they want an actual 3-ring hard copy binder. We do. So you know what we do? We give you both. We give you the 3-ring hard copy binder with all the policies and forms. We go over them with you. And then everything's also in the cloud where we could help you track all your business associates and training videos. Now, if you'd like to create a HIPAA program on your own, this is the website I would recommend you do. Do it on your own or do it with us. You need to do it. It's a law, and the HIPAA police are out. Disgruntled staff members are filing HIPAA complaints against their ex-employers. Patients, unhappy patients about your fees or the way they were treated in your office, they can file complaints with HIPAA against you, and now you have the HIPAA police knocking on your door for simple things, you need to have a HIPAA program. So you can do it on your own, starting with this website, or you could have us do it for you. One of the main things you need to do is a security risk assessment or a security risk analysis. If you haven't done one of these, you do not have a HIPAA program. It's probably one of the first questions the HIPAA police would ask you if they came knocking on your door. Do you have or have you done a security risk assessment? It's basically you're asking yourself questions like, do you have passwords in place? Do you use your cell phone to access patient information? We have a security risk assessment. It's 48 questions. It's pretty detailed. So our HIPAA and Medicare compliance manuals, we personalize the policies and procedures for you. We do the security and risk analysis with you. We give you all the forms, templates, logs. And we have them for Medicare and non-Medicare. We do them for chiropractors, acupuncturists, physical therapists, medical doctors. All right, so just a few closing comments. Please check with the carriers you bill prior to submitting claims to ensure that it is compliant. We can't guarantee this information. We'll guarantee payment from an insurance company or a patient. I want to thank everybody for attending. Here's our contact information. Just to let you know, we offer many products and services. We do seminars all over the country, webinars. We sell training videos. We have on-site consulting programs, membership programs. You could do even pay-by-hour consulting. We have a forms, letters, and templates manual you can purchase. We offer HIPAA compliance programs and Medicare compliance plans. Our Medicare compliance plan is very thorough, but doesn't take that much time. 2 to 3 hours, 2 to 3 phone calls with us, and you're done. Now you have to do some things on your own, but it's not 5 to 10 hours per week for 6 months. I've heard a few of my clients say they signed up with other companies for a compliance plan, and it's taking them, their staff members, multiple hours per week for many months. I don't understand that. I don't know why that would be necessary. So we personalize the policies for your practice. We give you the logs. We show you how to do internal audits and go through some checklists and proper use of the ABN forms and the $75 rule and prompt pay discounts. We go through all of that. There's our HIPAA program. Our HIPAA program includes an OIG compliance manual. So you get both within our HIPAA program. And those of you that don't see Medicare patients, that's fine. We still recommend you have just a general billing and coding compliance manual. Here's our acupuncture compliance manual. We give you sample acupuncture notes. We have a couple of webinars coming up. We're going to be doing a physical therapy webinar where we're going to be going over the PT codes in detail with diagnosis code examples, how to create a compliant plan of care, the 2018 therapy cap, very important changes that have occurred to the physical therapy Medicare cap. So that's going to be March 22nd at 1 o'clock Eastern Time. The fee includes the live and recorded. We have some doctors and staff that cannot make the live. Well, if you cannot make the live event, we'll email you the video and the workbook for the same price. The following week on March 29th, we have a acupuncture webinar. We're going to go over those codes in detail. Most acupuncturists can bill for E&Ms and other therapies on the same day. We're going to provide sample acupuncture notes. Same price, $169, includes the live and the recording. You get both. Even if you don't make it to the live, we're going to send you the recording. If you make the live, we're going to send you the recording anyway. We have a best-selling book on the best chiropractic and CPT codes to improve reimbursement. Has these little cheat sheets. We have a basic membership program. It's $99 a month. You just pay as you go. And then we have a comprehensive DCPT-MD integration program, complete analysis of your Chiro PT, all your medical codes, diagnosis codes, HIPAA forms, cash plans, monthly trainings, unlimited Q&A support. Come to our webinars and seminars. Many of them include CE credits. It's included with the price. You get our customizable forms, letters, templates. Come to all our seminars for free. Plus you get updates on a regular basis. We also have something called our Gold and Platinum memberships. Again, here's our contact information. I want to thank everybody for attending. Now let's go to questions and answers.